distinguished invited guests, ladies and gentlemen, Indina Milo, it gives me great pleasure to join you here today at Nyangbosre as we take another giant step in the overall improvement of healthcare delivery in Ghana. We have chosen this specific location particularly because we want to have a feel of how the Zipline technology is able to directly deliver to the last mile, making way for the equitable distribution of medical supplies to all parts of the country. And I do say that we observed 2 deliveries that were made by drones right at this very spot. Allow me, ladies and gentlemen, to begin by extending a huge appreciation to the Honorable Minister for Health, the Director General of the Ghana Health Service, directors at the Ministry of Health and the Ghana Health Service, Fly to Save a Life Committee members, and of course, Zipline, for the level of work that has been done in the last 3 years or so since we took the bold decision to adopt this technology in delivering medical supplies to all, especially those in areas such as we find ourselves today, 750 meters above sea level in Nyangbosre. It is a major issue that confronts many parts of the country which are difficult to reach. And the question that confronts us is, how do we get them help? How do we get them medical supplies when there is an emergency, when there is a snake bite, when there is someone who urgently needs insulin or other medical products, when a woman who is giving birth to a child urgently needs blood. I, about 20 years ago, had to watch my father die in Tamale Hospital because we were looking for blood frantically just to make sure he had blood. We couldn't find the blood. By the morning when we found the blood, he had died. So when I heard about the Zipline technology on a visit to Silicon Valley, I was very enthused, and I recognized immediately how it could be very helpful to the people of Ghana in very remote and deprived areas which are very difficult to reach in normal circumstances. So at the start of the operations of Zipline in Ghana in April 2019, when we were introducing this technology, there was a lot of skepticism about the prospect for the technology. There were people who claimed that this Zipline was meant to take pictures of people in their bathrooms. However, we persevered, and from a single distribution hub, you have, by the dint of hard work, added 5 more distribution centers delivering medical supplies to over 2,000 health facilities and saving millions of lives. Again, when the world was hit by the dreaded COVID-19 pandemic and all countries were challenged by the difficulties of even distribution of vaccines, the Zipline drones came in handy. My understanding is that close to 1 million COVID-19 vaccines have so far been delivered by Zipline to many health facilities across the country. This is no doubt, we're talking of 1 million COVID-19 vaccines. This, no doubt, is one of the contributing factors for which reason we have not experienced massive expiries of the vaccines as happened in many other countries. By this also, Ghana, through the operation of Zipline, has become the only country in the entire world, the only country in the world to use drones to deliver COVID-19 vaccines to dosing centers with the hope of ensuring that all citizens get the opportunity to be vaccinated. In addition to this, of course, one of the features of the Zipline centers is their cold storage facilities. Ghana was one of only 5 countries in Africa that could receive the Pfizer vaccine because of the storage temperatures it was required. And we were able to receive the Pfizer vaccine largely because Zipline could keep those vaccines at the temperatures for which they needed to be kept. So we had an added benefit. Ladies and gentlemen, COVID-19 still remains a sad tale of pain and anguish for us as leaders of the country. And even though we are at our lowest level, when I looked at the data yesterday, the total COVID-19 cases in Ghana as at yesterday was just 79. That is the total. Remember, at the beginning of the 4th wave, we were up as high as 15,000. But as at yesterday, through the good and hardworking management of the Ghana Health Service, the Ministry of Health, hardworking nurses and doctors in Ghana, and the support of government, we've been able to bring it down to just 79. However, since we recorded our first COVID-19 case, our health workers have shown that what lies in their chest is an undying love for this country. I convey the appreciation of the good people and patriotism of our health workers, even at the peril of their lives. Let's give them a round of applause. Ladies and gentlemen, our health sector remains an essential part of shaping our economic growth. How we are able to improve life expectancy and keep a nation healthy, to increase our workforce, drive economic growth, development, and prosperity, requires a lot of health investments. We cannot expect to achieve sustained life when access to medical health care to the preserve of a few. We need access to be open for everybody. Concerns for rural access to medical care does not only assault the life expectancy of our country, it also reveals the discrimination and inequality of our health system, in contrast to the campaigns championed by global health bodies for equal access to health care. When the government, led by the ever hard-working President Nana Addo Dankwa Akufo-Addo, has satisfied itself with the knowledge behind Zipline's innovation and how it will improve access to vital medical supplies using unmanned drone courier system for medical deliveries, we became interested in the prospect and were more eager to ensure that we seal an agreement so that the good people of Ghana can benefit from this innovation. When I look at the tremendous success within the 3 years of the operations of Zipline, I can only thank God for the foresight and the bold decision to move forward with this project. I am sure that the skeptics have now come to terms with the benefits of this project. Initially, they couldn't see the vision, but now I am sure that they understand the benefits of this project. Ladies and gentlemen, never again should we be seen allowing ourselves to be divided by politics when discussing our health, the health of our people. After all, when a snake is about to bite you, it does not ask you if you are MPP or NDC before they bite you. So let's not play politics with the health of our people. From Onako to Impanya, Vopsi to Sofioso, and now Anum to Kete Krachi, Zipline drones have been almost everywhere, flying over hills and valleys to bring healthcare closer to the people. And whenever you see a zipline flight, it means it is saving somebody's life. It is bringing critical medicine to save somebody's life. Since the government struck this agreement, the challenges of traveling for vaccine inoculation and delay in vaccine delivery has been resolved. Zipline has delivered, in addition to the 1 million COVID vaccines, Zipline has delivered 4 million routine vaccines to all many parts of the country. And it has delivered, as was said by the general manager, it has delivered 1.7 million deliveries of life-saving medical products and supplies of blood, anti-snake venom, serum, PPEs, and so on across the country. As I said, Ghana, our own Ghana, amazingly has the largest medical drone delivery service in the world. The largest in the world. Can you just think about that? Your country, Ghana, is leading the world. Over 300 high-quality jobs have been created as a result. And what is important to note is that the Zipline facilities in Ghana are being manned 100% by Ghanaians. 100% by Ghanaians. In fact, we are leading the world in this area, and I'm very proud of the hard-working men and women saving lives every day with Zipline. Beyond the immediate benefits of drone delivery, of vaccines and essential medical products to recipients, it is the improvement in the management and distribution of medical supplies from the various central storage facilities that is also important. The issues of wastage, unaccounted medications, poor disbursement records, expiry of medications have reduced substantially, and we now have a robust structure that in Ghana that can be appraised and monitored. The whole delivery process in the context of the Zipline in the supply chain is very much digitized. This additional distribution hub at Anum and the other one at Kete Krachi will serve all health facilities within the Afram Plains areas and many other hard-to-reach communities in almost all parts of the Volta region and most parts of the eastern region. With the Volta Lake sometimes posing transportation challenges for health workers, the hope of many people is hinged on how the service will promote seamless transportation of medical essentials for emergency and resupply situations for the health centers around the riverine communities. And of course, mountainous areas such as Nyangosure will definitely benefit from the direct delivery of medical supplies from Zipline. Truly, the beauty of our democracy is manifested when citizens benefit from good governance by way of interventions, policies, and programs that give meaning to their electoral choices. Today's event is another testament of the government's pledge to make sure everyone is covered in the provision of basic healthcare needs, especially in the campaign for universal healthcare delivery in the country. Ladies and gentlemen, at my meeting with the Pharmaceutical Society of Ghana in 2020, I encouraged the pharmaceutical industry to take advantage of the African Continental Free Trade Area Agreement, and I challenged them to assess innovative ways of assimilating technology in the dispensation of medication. I am happy to announce today that following a ceremony held last year, we launched the policy and guidelines for the National E-Pharmacy Program as part of ongoing efforts to improve access to the delivery of healthcare in the country. And very, very, very soon, the National E-Pharmacy Program will take off, and that will allow people from their mobile phones, when you have a medical prescription, to be able to find which pharmacy near you has the medicine. You'll be able to compare the prices of all the pharmacies and go to the one that you can find it the cheapest. For us as a government, any move that will make our country the epicenter of medical excellence on the African continent is of a high priority to us. I encourage all of us, including the corporate institutions, to come on board to support initiatives of this nature, either in cash or in kind. The singular success of you, Zipline in Ghana, I'm sure, is what has paved the way for the drastic expansion you are experiencing in the world. I've seen media reports of your exploits in Nigeria, in Cote d'Ivoire, in Kenya, in Japan, and in the United States. This is very, very impressive. I am also aware that recently a Ghanaian zipline flight engineer has been recruited to go to the United States to help Zipline in the building of systems. And Zipline Ghana is also leading the African expansion program. We have a lot to be proud of. And thank you very much, Ayuko, to Zipline. I know that Tobe mentioned a lot of, needs of the community, and similarly, which was reflected by our Honorable MP as well. I have taken all of those requests under consideration, and we will see to doing our best to deliver them. I know that we have done a lot generally on the Eastern Corridor Road. You will see a lot of progress being made on the Eastern Corridor Road. We also intend, given the tourism potential of this area, to invest in tourism. Of course, the Nyangosre, Konda roads and other associated roads have been mentioned, and we will look at it. We've started Agenda 111 with a district hospital at Ve, and we'll continue to make sure that development comes to you. Ladies and gentlemen, it remains now to urge all those in doubt who have not yet seen and accepted the benefits of the Zipline technology in delivering medical supplies, to heed to the many testimonies by beneficiaries and rally around the success stories to build a vibrant health dispensation. And now, ladies and gentlemen, on behalf of the President of the Republic, Nana Addo Dankwa Akufo-Addo, I declare the distribution centers of Zipline in Anum and in Kete Krachi jointly launched.